Ministry of Health, UAE, Prometric questions from January. A 2-year-old girl has been successfully treated for croup. Her parents ask, what should we do if she gets croup again? What is the nurse's best response? A. You don't have to worry. She now has immunity to croup and will not get it again. B. Come to emergency department immediately when she is coughing. C. Keep a cold mist humidifier running in her room, give lots of fluids and watch her breathing. D. You could put a crib in the bathroom, and let her sleep with the hot shower running to make steam. A 44-year girl is admitted to the hospital with suspected leukemia. Which of the following would be the best room assignment? A. With a 4-year-old girl who has rheumatoid arthritis. B. Alone in a private room. C. With a 4-year-old who has leukemia. D. With a 5-year-old boy who is having a tonsillectomy. In Glasgow coma scale, which one component is not there? A. Eye response. B. Verbal response. C. Motor response. D. Respiration. Glasgow coma scale eye-opening components except A. To touch. B. To pain. C. To speech. D. Spontaneously. Which action best explains the main role of the surfactant in the neonates? A. Assists with ciliary body maturation in the upper airways. B. Helps maintain a rhythmic breathing pattern. C. Promotes clearing mucus from the respiratory tract. D. Helps the lung remain expanded after initiation of heartbeat. Case. A 40-year-old man admitted to Edward lethargy and tachypnea. His skin is dry and flushed and has a fruity breath odor. An IV line is started and blood is drawn for lab studies. His blood glucose level is 840 mg per deciliter. And DHIS urine analysis reveals +3 glucose, +3 ketones. The physician diagnoses diabetic ketoacidosis. The nurse would expect to note all of the following physiologic abnormalities during the assessment of the patient. Except A. Jugular venous distension. B. Hyperkalemia. C. Hyperventilation. D. Poor skin turgor. The nurse's first priority in caring for this patient would be to A. Administer insulin IV. B. Administer insulin SC. C. Administer volume replacement fluids and insulin IV. D. Establish an airway and monitor its patency. Which IV solution would the nurse expect to use in the initial treatment of this patient? A. Isotonic saline solution. B. Hypertonic saline solution. C. Hypertonic saline solution. D. Hypertonic dextrose solution. During therapy, evaluation of this patient's serum potassium level is likely to demonstrate which pattern. A. An initially elevated level, followed by gradually decreasing levels. B. An initially decreased level, followed by gradually increasing levels. C. An increased level that remains generally elevated. D. A decreased level that remains generally low.
For various healthcare professionals study material, feel free to contact Nursing Manthra WhatsApp number +971 50251517 at any time. We are also reachable on all social media platforms. Make sure you text us before making a call to avoid traffic. Like this video, subscribe if you find the video is informative and helpful. Thank you.